So what we're doing today is we're trying to simulate what the smart hospital is going to be like next week. Your standardized patient will be in a bed. They'll be wearing a gown and they'll have exercise gear on. For the women, that's usually a sports bra and some shorts or capris or something like that, things. So they will be dressed like that. They'll be in the beds, go up and down, raises the head and stuff. My suggestion to you is you have 18 minutes to finish this. When you practice, you should always set a timer in the background for when you practice. And remember that every time when you work on your organization of this, every time that you decide to bring the bed up to your height or lower it down so they can dangle, that it takes time for the bed to move. And that's part of your 18 minutes. So you should get things, now today obviously I'm not going to spend any time with up and down, but if you are, like dangling them off the end of the bed and then you want them to lay back down and then you want them to dangle again and then you raise them up when they're in the bed so you can get to them and lower them down to dangle them and then put them back in the bed and raise them back up to do something. That takes a lot of time, okay? So watch your organization. Try to do everything that they're laying in the bed for while they're in the bed. Then when you need to dangle them on the side of the bed, you lower the bed down and do that, and then you put them back in the bed and you're done, okay? Because I've seen students lose time. Head up, head down, so just think about what you've got. Now, this bed is broken, so it is a little, I'm going to want her to lay flat in a few minutes, and so I'm going to make this be the end of the bed. You're going to scoot all the way down. Your feet are going to be on the table to get you where I want you. Okay, so far, so good. If somebody else said, you're going to set your timer,
yeah.
Ms. Suber?
Just let me know you're ready.
But now remember, I am talking, so it might take me just a couple of minutes past 18, but shouldn't. Okay. Oh, hand hygiene. Hello. How are you today?
I'm good. How are you?
My name is Terry. I'm going to be your nurse today, okay? I'm going to be doing, yes, I know you look a little scared there, but what I'm going to do is a brief head-to-toe assessment. It'll just take a few minutes, okay? First, can you tell me, I have a little order sheet here. Can you tell me your name and date of birth, please?
It's Ashley Conte, 7991.
All right, may I call you Ashley?
You may.
All right, thank you, Ashley. All right, we've got that. And also, I see here on the orders that you have some IV fluids going. Now, I'm simulating this, but your standardized patient is going to have an IV right here. And I'm going to come over and I'm going to say, has that been hurting you any?
No.
I don't see any swelling right there. And here's the IV pump. Obviously, I'm simulating that. And I look at my order sheet and I say, there is normal saline running. And on the pump, it tells me how fast it's going. And my orders say 50 milliliters an hour, 50 milliliters an hour. So the site is asymptomatic and the IV fluids are correct. Ashley, do you have any allergies?
Yes.
What kind of allergies?
Seasonal allergies.
Seasonal allergies, but nothing to drugs or food?
No, no drugs.
All right, thank you very much. Now today I'm going to start off by asking you a few questions. Can you tell me where we are today?
We are in Pickard Hall.
All right, do you know what room number?
No.
Not quite that oriented, but good enough. She knows we're in Pickard Hall. Can you tell me the day of the week today?
It's a Wednesday.
Wednesday, do you know the date of the month?
It's March 4th.
All right, very good. And do you have any idea what time it is about?
1:30.
Okay, close enough. All right, now, you seem to be alert and oriented at times 3. Now, can you tell how many fingers I have up? 4. So she heard my question, and she can see the number of fingers I have up. I want you to put your finger on one side of your nose and breathe in and out. I'm checking your airway, okay? In and out. Through the other nose, and then go to the other side. Okay, so she has a patent airway. Would you smile for me? Okay, her face is symmetric. And so that, yeah, I know, it's always odd, but thank you very much. Are you in any pain today?
No.
On a scale, let me rephrase it. On a scale of 0 to 10, with 0 being no pain and 10 being the most pain, how would you rate your pain today? That's fine. It seems like there's something else I need to ask you here, but maybe I'll think about it later. Okay, remember that you can always come about. Don't stand there and just stare and think. Just move on. You're on your 18-minute time thing. It'll either come to you or it won't come to you, and I'll tell you what you do about that at the end, okay? So let me go ahead and start. I'm going to start listening, okay? I'm going to listen to your lungs first, and every time that I set my stethoscope down on your skin, I want you to take a deep breath in and out through your lungs. Now, if I ask you to breathe too much and you start feeling dizzy or something, you just let me know, okay? Okay. Can I get you to sit up just a little? So, first spot above the clavicle, and these would be in my ear, but I can't do that and talk at the same time. Breathe in and out, please. Not up on the neck, but down where you can hear. I'm going to come down, and your instructor will be here watching. You're still providing for privacy. In and out, please. In and out. Now, to get to the lower spot, I need to go in here, breathe in and out. And don't do the I can't see, you know, make sure that you can see where your placement is. Breathe in and out. Okay, how are you doing with that?
Good.
I'm gonna, on the side, we're gonna do the 2 spaces here. In and out. Do that again. Can you breathe a little deeper? Okay, I'm going to come around to the other side. Okay. Your instructor will be walking around behind you, trying to see where you're placing your stethoscope. Placement is important. Remember, it's skin to stethoscope. Now, you can't see all the 8 places on the back, so I'm going to go ahead and not do that, but you would listen to the full 8 places on the back. Then you're going to verbalize what the lung sounds you heard were. Lung sounds were clear to auscultation, no adventitious sounds heard or abnormal sounds, and they were clear on the anterior, posterior, and lateral sides by lat. Okay? Now, what I'm going to do is that I'm going to tell you that I am going to listen to your heart now, okay? I am going to listen to your heart. That's what I forgot. So I want you to just breathe normally, okay? Now, what's going to happen is...
It's on the other side.
Oh, it is. The little guy went to the other side. This little guy is always on the bedside table by your standardized patient. And this is what you have to do. You have to come over and you say, excuse me just a minute, I'm going to show something to my instructor. So here we are. I'm going to find that second intercostal space, right sternal border, and I'm going to say, this is where I'm going to start. This is the aortic. Second intercostal space, right sternal border. I move my stethoscope across. Second intercostal space, left sternal border, pulmonic. I move it down, still on this, whoa, okay, I've lost his sternal border. There it is, more like that, more like that, more like that. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. And then I come to the fifth intercostal space, left mid-clavicular line. And that's the mitral. I'm going to verbalize all those on the mannequin. I'm going to turn, that's just going down, okay? And I don't have to turn it going up on the mannequin. But I would say all those points. Now I'm ready to move over to my patient. This can take you anywhere from 20 seconds to 3 minutes, okay? Depending upon how well you know that dialogue. So you need to work on that so it only takes you 20, 30 seconds, okay? If you're unfamiliar with it, it just eats up time. You listen to the heart first with the diaphragm, just like you learned today. Just breathe easy. I'm going to be listening to your heart. I find the second intercostal space, and you have to feel for that. So, and then I place my diaphragm down, and I just listen. Okay, this would be my ears. I move straight across. Notice I do not have to verbalize everything again. I just go through it. I'm going to go down, and I'm going to listen to all 5 areas. Then, if my stethoscope flips, I'm going to say, now I'm going to listen through the bell. And I'm going to come back up with the bell. Same 5 things. Or, sorry, I hit you in the chin. Or I would say that now I'm going to listen with less pressure using the bell.